Dr. Edsel Salvaña joins us now for more on his take on the pandemic response. Doc Edsel, thank you so much for joining us on The Final Word. What do you make of the recent number of COVID cases? Is there any cause for any kind of concern on your end?
Right. Good evening, Rico. Good evening to everyone who's watching. These cases, week on week, we had an increase of about 9% from last week, and the week before that, another 9%. Today, we had, I think, about 135 new cases. So the cases remain below 200. And to tell you the truth, we expected it to be much more because this is about 2 to 3 weeks from the elections, and also we saw there were a lot of rallies at that time. So what this is telling me is, we do expect some increase in cases because of more mobility and more activity, but our protocols are working. Our masks are being worn. We're doing our vaccination drives and boosting. So it's holding. And most importantly, most of these cases are mild. Very few of them are severe, very few deaths. And our hospital care system is intact and has a lot of capacity.
So is the low number of cases, you think, because there's not enough testing taking place?
Well, if you look at the positivity rate right now, the positivity rate is about 1.2%. So we are doing adequate testing. Of course, there are antigen tests that are not being documented. But the bottom line there is, first of all, the positivity rate remains low. So there's not really all that many that are being missed. And second is that our healthcare utilization is really rock steady at about 16-17%. And so there's a lot of capacity. If ever we are missing cases, then, it's not enough to stress the system. And clearly not very many of these are severe because they don't end up in the hospital.
And I'm sure our kababayans want to know, no potential COVID surge anytime soon then?
Yeah, I mean, there's always the potential for any kind of surge, especially with these new variants that may be more transmissible. But we do have layers of protection that are holding. And again, I think that the biggest super spreader events were elections and the rallies that preceded them. And so far, so good.
Well, so far, we're about 3 to 3.5 weeks separated, no? From those massive rallies, meeting the advances that took place in the first week of May. Regarding the vaccines for primary doses and boosters, do we still have enough supply?
I think according to the National Task Force, they have more than enough supply. The issue is there's about 2 million doses of the vaccine that may be expiring at the end of June, and that's why they want to make sure that these are given to patients, to people as soon as possible. We still have a big backlog of people who should be getting their first boosters. And of course, we've started boosting those 60 years old and above and immunocompromised. So hopefully we can use up the stocks that are expiring in June 30 so that they don't get wasted.
So are we seeing some hesitation from our kababayans from getting their first booster shot and even their second booster shot?
Well, I think that a lot of people are of the mindset that, getting two vaccines is already fully vaccinated, which it is. That's how the CDC defines it. But there's a new concept called up-to-date with vaccination. And because of these new variants, we're seeing lower efficacies, not just in preventing infection, but even about a 15% drop in protection against severe disease, at least for Omicron and for Delta. So nowadays, the recommendation is because predominantly it's all Omicron that we're seeing, it's a good idea. It's almost essential to get that first booster. As for the second booster, the data is still being collected, but right now the only ones that we do have data for and are going ahead and giving second boosters to are those 60 years old and above and the immunocompromised.
And as you mentioned, Doc Edsel, no? Millions of vaccines expiring soon, translating into hundreds of millions of pesos lost if they are not used. How must the ordering of vaccines and boosters be handled and budgeted going forward? What should be the lessons learned here?
Right. I mean, I'm not privy to how those policies are done because that's under the National Task Force. But if you recall, at the start, the government had assured that we would be ordering enough vaccines, but there were also a lot of private companies and LGUs that decided to order their own vaccines. And so, even though the National Task Force had assured that there would be enough vaccines once the supplies came, there were still a lot of these over orders. So I think that we have to really do a better job of planning and anticipating, and not panic buying, especially when supplies are tight. But again, it's always still better to have more vaccine than too little vaccine. And I think that at this point moving forward, we just have to do the best we can.
And Doc, you've done so much with the DOH Technical Advisory Group. And in 30 days, we will have a new administration and a new health secretary. What is on your wish list for the next DOH boss?
Yeah, I think the most important for me, the most I'm concerned about, is that there should really be some continuity of the measures that we're doing right now. Because as we've seen, there are countries that have had spikes of COVID, especially when they start removing their masks. And so this has to be a gradual process. I think that overall, our current policies have already proven their worth, especially after elections and these big super spreader events, and it barely budged. And so I think I'd like to see some continuity of this. And if at some point WHO does declare that the public health emergency is already over, then we should only gradually decrease these restrictions so that we don't have any miscalculations.
And continuity is indeed key, no? And your name, Doc Edsel, is being recommended by some quarters as the next DOH secretary. Will you accept if you're nominated?
Well, at this point, you know what I know, and so from that standpoint, I prefer not to. I'm really concentrated on continuing the COVID response at this point. I'll cross that bridge when I get there. I don't want to preempt anyone. I think that my biggest concern really is that we don't have any more future surges, and that we really stick to the plan in terms of living with the virus, so that as this becomes more endemic, then it becomes something that is manageable and is no longer a huge risk for our country.
And many of your friends in the medical field are, of course, offering their support if you become the next DOH secretary. And they've also stressed that the next chief should be incorruptible and ready to listen to health workers.
Yeah, I mean, I think that the healthcare workers have really shown their courage, their determination to help our country, and we really love our country, and we really did our best in the face of overwhelming odds at the very start, and now we're doing quite well. I think that if we have the support of all the healthcare workers, that really is something that is essential and is very important moving forward. So I think we just all have to work together. We got to protect each other. Whoever the new health secretary is will need our support, and that we really should continue to protect the health of the Filipino people.
Okay, my last question to you. Should the next DOH secretary be a doctor?
Well, I think that it is important for the health secretary to be a doctor. I don't know if there's any law against that they even if they're not a doctor. But it is a complex job, and there's a lot of specialized language when we talk about medicine. If at some point there are, like in the United States, the Department of Human and Health Services secretary is not a doctor, as a matter of fact. But then, you can also have people under that person, part of the management team are doctors. That is probably doable. But I think everyone's really gotten used to the idea that the health secretary is a doctor. And in fact, there are some sectors that want the the health secretary to be a practicing doctor. I think more important is that the health secretary is able to understand the needs of all the different health sectors and act accordingly, whether they're practicing, they're public health experts, or they're administrators. All these skills are essential, and that I think that as long as there's a good management team and everyone's heart is in serving the country, I think that those are the most essential elements that will lead to success.
Dr. Edsel, all the best to you. Thank you so much for joining us on The Final Word. Dr. Edsel Salvaña, member of the DOH Technical Advisory Group.